Welcome to the Autism Bridge by Dr. E. Okay, so today I would like to discuss a very common question posted by a lot of parents. Okay, autism and heavy metal, the link and the treatment. Okay, so parents, the relationship between autism and heavy metal has been one of the most debated topic in autism research. Yes, while some studies have suggested that environmental toxins may contribute to neurodevelopmental disorder like autism. However, current scientific evidence does not support heavy metals as the primary cause of autism. Okay, what are the heavy metals? So a lot of parents ask this question. Okay, heavy metals commonly discussed in autism include five important heavy metal, that is mercury, lead, arsenic, cadmium, and aluminium. This metal can affect the nervous system when exposure is sufficiently high, especially during the pregnancy and early childhood. So the next question is there any link between heavy metal and autism? So based on the current research, it suggested that autism is a complex neurodevelopmental condition influenced by both genetic and environmental factors. Yes, some studies have found higher level of certain heavy metals like mercury, lead, arsenic, cadmium, and aluminum in some of the subset of autism children compared with the control. Okay, meaning that some autistic children may have high heavy metal, some autistic children may do not have exposure to any heavy metals. Okay, so prenatal exposure to environmental pollutants may influence the brain development. That is the one of the closest suggesting link between heavy metal and autism. So what we don't know at this moment, what we don't know, there's no convincing evidence that heavy metals alone, heavy metal question is, the word is heavy metal alone cause autism. Not all autistic children have elevated heavy metal level. All right. Many children with elevated heavy metal exposure do not develop autism. Okay, that is the controversy. Okay, so most researchers now believe autism results from a combination of, this is agreeable by many researchers, genetic susceptibility, immune factors, environmental influences, brain development difference rather than a single toxin or exposure. Okay, so they believe that it's a combination of genetic susceptibility and environmental influences, okay, which actually affect the whole immune cascade of the autistic child. All right. So a bit more on a detoxification theory. Yeah, we believe that some parents actually they have read somewhere. Maybe some parents have they have done it. The detoxifications theory or the detoxifications process. Okay, so yes, some researchers propose that certain autistic individual may have reduced glutathione level, which is very important for detoxification process, increased oxidation stress, mitochondrial dysfunction, and impact detoxification pathway. So as we know, the theory is glutathione is the body major antioxidant and it helps to eliminate toxins through the liver. So the possible mechanism suggested is that environment toxin causing oxidation stress, which causing reduce in glutathione level. In return, it can cause neuroinflammation or the brain inflammation and also worsening of the behavior and developmental symptoms in a susceptible individual. Okay, not all. However, this remains a developing area of research and does not prove that the heavy metal caused autism, right? So how about heavy metal testing? Yes, yeah, the testing or the test commonly marketed include hair mineral analysis, urine provocation testing, blood heavy metal level, urine or stool heavy metal level. Okay, so these are the common tests have been done or carried out to detect any heavy metal exposure in an autism or autistic child. All right. So, what are the interventions for those children who are being exposed to heavy metals? Okay, the most effective intervention remain nutritional support. Okay, some clinicians focus on supporting antioxidant system through adequate protein intake, fruit, vegetable that is rich in antioxidants like vitamin C, vitamin E, selenium, zinc, omega-3 fatty acid. This nutrient help to support normal detoxification pathway and reduce oxidation stress, which in turn it helps to reduce the brain inflammation or what we call neuroinflammation, which in summary, it helps to improve both the sensory behavior and also some of the autistic symptoms. Okay, the other one is glutathione support. All right, so sometimes some clinicians will use a supplement like NAC, liposomal glutathione, methylation support like folate, B12. Okay, to enhance the detoxification pathway. All right. Next, come to a bit more controversial controversies therapy, that is chelation therapy. Okay, so chelation uses medications to remove heavy metal from the body. Example, DMSA, EDTA. But bear in mind, so chelation should be done under close supervision and a confirmed heavy metal exposure. Okay, so however, there is no good evidence that chelation improve core autistic symptom in children. Okay, so that is what the scientific or the clinical study believe. Okay, chelation does not improve the core symptom of autism. However, there's some parents reported that after doing chelations, there's some form of improvement in their sensory behavior. Okay, but bear in mind, parents, chelation can cause mineral deficiency, kidney and liver's enzyme derange, and also severe electrolyte disturbance. So, and also, there have been report of a serious adverse reactions or sometimes death, even though it's very rare, from inappropriate chelation and without close supervision. So, in summary, in a balanced clinical perspective on autism and heavy metal, yes, we agree that heavy metal exposure can affect brain development and it should be prevented whenever that is possible. Some autistic individuals may also have increase in oxidation stress, mitochondrial dysfunction, or outer detoxification pathway that warrants further study. All right. However, the current scientific evidence does not support heavy metals as the primary cause of autism, nor does it support routine chelation therapy for autistic children without proven heavy metal toxicity. All right. So again, in summary, the strongest evidence for improving outcome in autism remains first, early identification and detection, intensive early intervention, speech and communication support and therapy, occupational therapy, behavior and education intervention, and lastly, optimizing nutrition, sleep, and overall health. Okay, parents? So I hope it helps, and I see you back in the next episode. Bye. See you.